Good morning. To give you an update, it's been a little while since we've been in person, so it's great to see everybody. As of April 14th, 2022, Tulsa County residents have died from COVID-19 and 73,345 residents have tested positive for COVID-19. We continue at the Tulsa Health Department to coordinate public health response to the pandemic. Our agency continues to provide COVID-19 testing, epidemiological investigations, and contact tracing. We provide safety guidance to local businesses, municipalities, schools, faith-based organizations, and event organizers. We continue to staff a hotline to answer questions from the community, conduct outreach and community engagement to educate and inform the public, and of course, we coordinate and administer a countywide community COVID-19 vaccination program. 4 months ago today, on December 15th, the first Tulsa County residents were vaccinated against COVID-19. Since that day, more than 40% of Tulsa County residents aged 16 and older have received at least one dose of the COVID-19 vaccine. Almost 30% are now fully vaccinated. This is greater than the state average, and I want to thank our local healthcare systems and public health partners who have worked so diligently to make this possible. This is great news, and let's keep up this momentum. Everyone has been impacted by the pandemic, and if there's one thing our divided society can agree on, it's that we're all eager for COVID-19 to be a long, distant memory. There's been a lot of discussion about herd immunity and when we will reach it. Herd immunity typically means that 70% of the population is immune to a particular infectious disease. Both vaccination rates and infection are taken into account to achieve herd immunity. With COVID-19, it's difficult to factor infection into herd immunity as it's a novel virus and not clear if infection with COVID-19 makes a person immune to further infections. Therefore, I encourage everyone age 16 or older right now or as soon as they can to receive the vaccine. The Tulsa Health Department is administering the vaccine at 4 of our health centers throughout Tulsa County. Anyone can schedule an appointment online at vaccinateok.gov, or you can call 211 and make an appointment over the phone. Next week, the Community Vaccination Center will open to the public at the TCC Northeast Campus at the corner of Harvard and Apache. This federally supported vaccination center will be able to administer 21,000 doses per week, which will bolster our county's already robust distribution network and is more conveniently located in an underserved community with historic health disparities. The bottom line is this: it's easier than ever to access a vaccine. Don't wait. Now is the time to sign up for your shot. It takes about 2 weeks after you've received both vaccines in a 2-dose series for your body to develop the immune response to help prevent infection. The sooner you get it, the sooner you'll be protected. It's normal for people to have questions about vaccines. The sheer amount of information and misinformation about COVID-19 vaccines can be overwhelming to anyone. I encourage you to talk to your trusted healthcare provider or call the Tulsa Health Department to speak to a public health professional who will take the time to listen and answer any questions you may have. We're here to listen without judgment, offer clear, science-based facts about the vaccine. We have always maintained a commitment to data-driven approach to public health, and the COVID-19 pandemic is no different. The CDC continues to recommend a layered approach to preventing the spread of COVID-19, including vaccinations, wearing a mask in public, watching your distance, and washing your hands. THC continues to recommend these common sense safety measures for all Tulsa County residents, regardless of an ordinance or mandate. Scientists have determined that fully vaccinated individuals can safely gather indoors without a mask as long as everyone in attendance is fully vaccinated and no one is at high risk for severe illness. This is great news for family and friends, and I myself have enjoyed gathering safely with extended family for the Easter holiday. I haven't seen them in person in almost 2 years. Scientists and medical professionals still recommend the wearing of masks in public. When you wear a mask, you protect others as well as yourself. Masks work best when everyone wears one. As we learn more about vaccines and how that will affect the spread of COVID-19, we continue to update our community with the greatest health and safety information. So far, our agency has reviewed the safety plans for more than 340 local businesses, schools, faith-based organizations, and events. We will continue to be a resource and support all local entities in their efforts to keep their workforce, customers, and guests safe. If you have questions, please call the Tulsa Health Department. We are a community resource, and we're here to help you. On Tuesday, the FDA and CDC recommend a nationwide pause on the use of the Johnson & Johnson COVID-19 vaccine in response to a rare adverse reaction that caused blood clotting in 6 vaccine recipients. THD immediately suspended the use of that particular brand of vaccine in our clinics. We didn't cancel any appointments. Everyone who had an appointment was able to choose Pfizer or Moderna vaccines. The type of potential adverse reaction following the administration of Johnson & Johnson vaccine is extremely rare. It's occurred in less than 1 in every million recipients. However, safety always has been and always will be our top priority. If you have already gotten Johnson & Johnson vaccine, your risk for having this adverse response is very, very low. But there are some symptoms you can keep an eye out for. If you received the vaccine 3 weeks ago and have experienced a severe headache, abdominal pain, leg pain, or shortness of breath, you should call your personal healthcare provider. These will feel much different than the typical mild flu-like symptoms that are characteristics of many vaccinations. We do not expect this to slow our distribution plans for Tulsa County residents. Vaccine supplies remain adequate to meet the demand. The approximately 5,500 doses of Johnson & Johnson vaccine on hand at the Tulsa Health Department will be safely stored until next steps are determined by the FDA and the CDC. I'd like to give you a little overview of some of our data trends. For the week ending April 14th, there are 333 weekly cases. This is slightly above previous weeks and above our lowest week, which ended on March 23rd with only 279 cases. Our weekly cases are comparable to those cases in early June of 2020. Our daily hospital admissions are also comparable to early June and are consistent with that time frame. Of those who have received vaccines, over 34% are those aged 65 and over 26% were those aged 50 to 64, and at just over 19%, each of those aged 36 to 49 and 18 to 35. So we're definitely great to see that uptake in vaccine. Again, don't wait. Now it's time to sign up. We have plenty of vaccine available. Please enter the portal and let's get you vaccinated. I also want to encourage everyone to complete their demographic information when you register for your vaccine. We're missing race data for 23% of vaccine recipients and missing ethnicity data for 31% of vaccine recipients, which makes it a challenge for public health officials to know the complete picture of who's being vaccinated in order to ensure equity and appropriately target underserved populations. The Tulsa County zip code risk map was updated yesterday, and I'm pleased that we again have no red zip codes this week. There are 11 in the green, 25 yellow, and 6 orange. And you can review your zip code and the corresponding public health guidance associated with that zip code on our website. In closing, if you're sick with symptoms of COVID-19, please seek testing. Spring allergy season is in full swing, but if you have not been vaccinated, you should consider COVID-19 testing if you're experiencing any of these symptoms. If you want to be tested, the Tulsa Health Department will test you. I'd also like to take a moment to clear up a common misconception about the COVID-19 vaccine and blood donations. If you have been vaccinated, you can give blood immediately as long as you're feeling well. There's no deferral period because of the COVID-19 vaccine. Our local blood banks are experiencing a marked decrease in blood donation. I want to make sure there's no confusion about who can donate. Regardless of your vaccine status, please consider donating blood. Please continue to follow the recommendations of health professionals to stay safe. We continue to provide updates and information and encourage everyone to seek credible sources of information as we navigate safely towards the end of this pandemic. Please, let's keep our eye on the ball. Let's not spike the ball at the five-yard line. Let's stay vigilant. We're definitely getting there. Thank you for your time today. I'd like to introduce Mayor Bynum.
Thank you very much, Dr. Dart. And as always, I'm grateful for the work that you and your team at the Health Department do. You know, usually at these briefings, I've been praising the Health Department for the local independent guidance that they give us. Today, though, I really want to highlight the work that they've been doing on vaccinations here in our city. Today actually marks, just fluke of timing, this is my 2-week date from having gotten my second vaccination when your immunity is supposed to be at full strength after getting it. Both times that I went to the Tulsa Fairgrounds to get my vaccinations, I was so impressed by the staff, the volunteers that are out there, keeping it moving, making you feel welcome and comfortable. I'll be honest, I was surprised by how happy everybody was at the vaccination clinic there at the fairgrounds. Throughout this pandemic, in dealing with the issues we've had to deal with, it's been pretty grim. And so to be at a place where you see just people of all parts of our community, a lot of them from just throughout the city of Tulsa, people of all races, people of all sorts of different backgrounds, all of whom are just so excited to get this vaccine, recognizing that it represents a light at the end of the tunnel for us. And so I'm not a huge fan of getting shots. I loved going out there, and I just am so thankful for the operation that your team has. And that really, more important than anything else that I'm going to talk about today, I think is what I really want to stress, is that everybody in our community who wants to get a vaccine should get one. If you're on the fence about whether or not you should do it, call your doctor and ask them. Talk to somebody who's had it. There's been a lot of debate throughout this pandemic about different restrictions and different steps that we've taken, whether we should take them or we shouldn't. But vaccinations, I think, have become a real point of unity. As I just mentioned, I was excited to get mine. You see Governor Stitt out there getting his, encouraging people to get it. You see folks at the city of Broken Arrow, with whom we've had some disagreements. They're doing everything they can to make vaccinations as accessible to the citizens of Broken Arrow as possible. And so while we've had, at different points of this pandemic, some disagreements on different steps that have been taken, right now, I think that there's broad support for people getting this vaccine so that we can stomp out this virus and get this awful pandemic behind us. I also want to speak just to my experience from getting it. You hear a lot of folks with different side effects. I'll just speak to mine. I had no side effects after the first shot at all, other than my shoulder was a little sore for the first day. After my second shot, I didn't have any side effects until right when I hit that 24-hour mark. Woke up in the morning like super excited, thought I'd avoided all side effects. And then right at about the 24-hour mark, started feeling fatigued. And I was pretty fatigued for about 12 hours. And then by that night, totally back to normal. And have had no side effects since. That to me, 12 hours of fatigue is a small price to pay for getting 90% plus immunity to this virus. Again, I just want to thank the team at the Tulsa Health Department, the State Department of Health, and our tribal nations who've done such a just fantastic job of something that we've never had to do in our country's history, which is to create and deploy a vaccine to every American who wants it as quickly as possible. Of course, the big subject at City Hall right now is the mask ordinance. And as I announced last week, our trends remain in a very good place, and the recommendation of the Tulsa Health Department is that we can allow our mask ordinance to lapse on April 30th when it is scheduled to sunset. I think context is really important here. As we said when we adopted the ordinance, we were doing so to protect our hospitals, because our hospitals were coming to us, and you saw them in this room come forward and say how a mask ordinance was needed to protect their capacity, that they were alarmed by the rapid increase of COVID hospitalizations, and they told us that something had to be done to stop the spread of the virus, or to slow it at least. And the council and I, we had several options that we could pursue to slow that spread. We could do another shelter-in-place order. We could close restaurants and bars. Or we could implement a mask order. And of those main options that were deemed the most effective things to do, far and away, easily, the mask order was the least harmful to families in our local economy. And so we adopted that in July. We adopted it in order to protect our local healthcare system's capacity to save lives. This is the same reason that we adopted unprecedented regulations in the early going of the pandemic, to protect hospital capacity. On the day that I signed the mask ordinance, July 19, we were at 153 COVID hospitalizations in Tulsa. Now, unfortunately, our focus here in Tulsa, at the city of Tulsa, on slowing spread was not necessarily shared by all municipalities in the region that utilize Tulsa hospitals. And so we slowed the spread in Tulsa, but we continued to see hospitalizations climb. And the data during that time showed us that the majority of COVID hospitalizations in Tulsa, when we hit our peak in January, were not actually people from Tulsa. They were people from outlying communities that didn't have regulations in place. But again, on the day that I signed our mask order, there were 153 COVID hospitalizations in Tulsa. On the day vaccinations began, December 14, we were at 405 COVID hospitalizations in Tulsa. When phase 2 of vaccinations began on January 4th, we were at 453 COVID hospitalizations in Tulsa. And then something remarkable happened over the next 2 months. As those most at risk, those prioritized first under our state's vaccination rollout program, received their vaccinations and boosted their immunity, our COVID-19 hospitalizations in Tulsa plummeted. By March 9, when phase 3 of vaccinations began, we had 70 COVID hospitalizations in Tulsa. So we went from 453 COVID hospitalizations on January 4 to 70 on March 9, 2 months later. This week, on the most recent day that we have data for, which would have been Tuesday, we were at 40 COVID hospitalizations in Tulsa. These numbers are incredibly important for two main reasons. First, they demonstrate the power of the vaccination program and why it's so important for as many people as possible to get this vaccine. Second, they show that our hospital capacity is not in danger any longer. This is why the Tulsa Health Department, which by the way, has not been accused at any point of this pandemic of being lackadaisical in their warnings to the citizens of Tulsa, why they are recommending that it is okay for us to allow the mask order to sunset on April 30th, and it's why I agree with them. There's a key point here that I think is so important for everybody to recognize. I join all 9 members of the Tulsa City Council in saying that this pandemic is not over and that we should all, every one of us, continue to be smart in how we go about our daily lives. The absence of a mask order does not mean people should start burning your masks. Tulsans should continue to proceed with caution. The reality is that every single person in this city has a different idea in your mind of when it's going to be safe to return to a sense of normalcy. Some folks are already there. Some people aren't going to be there for a long time. The issue at hand with a mask ordinance is this: should the city of Tulsa use its police powers to make you wear a mask? As your mayor, I think that the city of Tulsa should only use its police powers when they're absolutely necessary. Beyond that, Tulsans should be free to go about your lives as best you see fit. It was necessary to invoke those police powers in the early going of the pandemic to allow our hospitals to acquire the equipment and the processes necessary to save lives. And it was necessary to invoke those police powers when our hospital capacity was endangered in the summer and into the spring. But today, with COVID hospitalizations at record lows and vaccinations available to everyone who wants them, it's no longer necessary to invoke the city's police powers as it relates to a mask ordinance. We'll still continue to require Tulsa Health Department approved safety plans after April 30th for any event over 500 people, and we'll continue to require masks be worn by those who prepare and serve food and beverages. We do remain in a pandemic, and these restrictions reflect that reality. At every step of this pandemic, we've followed the data and we've listened to local independent guidance. The decision to let the mask ordinance expire at the end of this month is in keeping with that approach, and we'll continue to follow that approach as this pandemic continues. Thank you.